Welcome to The Hanley Effect, a podcast by the Hanley Foundation designed to educate, change minds, and save lives. Our goal is to inspire you, showcase our innovations, and change the conversation about addiction and mental health. Join us as we unravel stories of resilience, recovery, and hope.
Hi, everybody, and welcome to The Hanley Effect. I'm John Dyben. I'm here with Dr. Rachel Docekal. How are you, Rachel?
Hello, Dr. D. How are you?
I'm great. I'm really
excited.
It is. I'm excited about, we have a dynamic duo with us today. And it's funny, they sat down and I've known them both and it just struck me what they're doing and how they are literally the perfect team to be doing the incredible work they're doing.
Visionaries.
So many good things. So I want to be as quiet as possible because I want to hear from them. Dr. D, do you want to tell us who we've got here?
Sure. Two of my favorite people on the planet. So I talk a lot about my gas tank and things that fill up my gas tank. These two professionals fill up my gas tank on a daily basis. They are visionary and are truly changing the world and changing the field of behavioral health every day. Welcome, Dr. Heather Howard, and welcome, Alli Jimenez.
Thank you.
Our Chief Strategy Officer and our Vice President of Program Development. You two are incredible.
Amazing.
So just
you.
tell us a little bit about your collaboration and yourselves and just all that good stuff. How did you meet? So let's start there. How did you meet?
So I had reached out to Heather. I was given her contact information almost a year ago, maybe over a year ago, and I had reached out to ask her to do a presentation on our safe prescribing initiative. And so we scheduled a lunch and we met at a restaurant. We had never met before. We had never talked other than email. And we sat down and we started eating lunch. I think we were at J. Alexander's across from FAU.
One of my favorites.
And it was interesting because we just started talking and we talked about so many things. And I was like, wow, I really like this lady. She's so smart and she's so humble. And she's just somebody that I want to work with in some way, shape, or form. And that's kind of how that happened.
It was great. When I started talking to Alli, we just had the synergy. We thought the same in terms of addressing oppressive systems, removing barriers, decreasing stigma. And her network was so huge. For me, it's network and working together and community partners and really try to build that. Well, Alli puts me to shame. So that was very impressive. I said, this woman could get a lot done.
I mean, I talk to everyone everywhere I go. So, I mean, I enjoy it. Everybody has a story to tell, So
I remember you calling me and saying, you have to meet Dr. Heather Howard. You're going to love her.
Yeah.
And she was right. I did. First time we really met was when we went up north to study the perinatal women's programs in New Jersey and North Carolina. And I think I pulled you aside after about 6 minutes and said, oh my God, you're right. She's fabulous. She's fabulous.
Yeah, that was a really good trip, and I think the last few months we've been able to work really closely together, and we've kind of developed this thing where like we'll send each other a text and we'll be like #soul sisters because like we always just align on so many things when it comes to how we'll solve problems or things that can sometimes upset me. I'm like, this is not right. We need to find a solution, and then she's like, you're absolutely right. Let's figure it out together, and we've really been able to do that. So for me, it's been an honor really to work with her, and then also with you, both of you guys.
The Passion Project.
The Passion
Tell
Project.
us about some of those innovations that you two have come up with. There's so much good stuff.
So thrilling. So I would say, the beginning of my career was 21 years in a birthing hospital, Brown University-based birthing hospital in Providence, Rhode Island. And it's such a great time, right? Because starting family, new beginnings, and this strategic point where people want to think differently. Maybe I want to do differently of my parenting skills. Maybe I want to stop using substances and alcohol. We know that in the research that it's the greatest opportunity for change. And I am strategic, and I always say, okay, let's focus on where we can have the most positive impact. It was such a joy, being in those spaces and really working with families across socioeconomic, and just wonderful. The end of that tenure there, it was the time when so many women were dependent on prescription opioids. And they just had no services, no one to help, and nowhere to go, and basically had this parallel fear of removal of their infant, and my infant will have neonatal opioid withdrawal syndrome. So if you can imagine, pregnancy and postpartum is already stressful enough, and then you add that. So that really propelled me to go on to continue my education at Simmons University in Boston, because the physicians I were working with really, there was no research in this area. And I said, it was really one of the patients that I had worked with that she was in our care, and our physicians were saying, if you taper off the methadone, then we're going to call DCF. And she really wanted to taper because her first baby had NOWS, and she had been in recovery for an extended amount of time. She had a lot of support. She had wraparound services, but she was still being coerced to not have any health empowerment in her decision making. So she went across to Massachusetts, 15 minutes away, and she found a provider that supported her with her tapering. However, when she delivered, I asked her if I could follow up with her postpartum, because she was no longer my patient. And she did follow up with me postpartum, and she said, everything's great. I'm with the baby. I'm in recovery. I'm doing my support groups. One thing happened, though. When I delivered, one of the nurses saw that I had been on methadone first trimester, and she stood by my bed and said, how could you have ever been on methadone and pregnant? And that conversation that I had on the phone said, I'm going back to school.
Wow.
And so, I always, that part of this journey for me has been all, the privilege of working with so many women that are disempowered in these very serious health decisions.
Yeah. And that judgment. I mean, golly, I can't even imagine.
Well, it's judging you at your very core. At the very core, it's dehumanizing your very, very core, and that people don't even realize that is what. That's stigma. We talk about stigma, and it's a word people kind of throw around, but that's really what it is. It's crushing you at your core. And so you went on to get your PhD, and you went into academia for a while before you came, before we got to have you here. And you actually did do the research and published on this and studied this?
Yes, for about 8 years. And, you learn a lot through clinical research, because as a researcher, participants tell you things that they don't tell their therapist. So, you actually get a lot of information that you may not have in the therapeutic relationship. But just one, and I don't know if I told you this, Alli. About a year ago, I had lunch with our now clinical supervisor of Casa Flores. We were celebrating that she received her LCSW after 2 years of clinical supervision. So and she said, can I take you out for lunch? And I said, okay. And I sat with her. This was a year ago. And she said, how are things going at Florida Atlantic University? And I said, wonderful. However, I have this dream that one day that we can have a program for pregnant and postpartum women in Palm Beach County. So good. And then about 7 months later, I met Alli.
Yeah, and when I really think about the journey getting to where I'm at, I know I've had the pleasure of telling Dr. Dyben this when I first came to work over at Hanley Center, and then Heather and I had a meeting with someone that was interested in becoming a donor, and it was like, this is a perfect opportunity to share really what propelled me to want to do this. So last year, Rachel and I were talking, and this idea came up. And I said, Rachel, when the time comes to build this program, like, just remember me. Like, I really want to be involved in some way, shape, or form. And
because you were running all of our programs out in the community.
Yeah.
You were our director of programs.
Yeah, I was running all the community-based programs, and I really enjoyed it. But I felt like there was just something more that I had to offer. And what I've realized in working in this field, and when we talk a lot about stigma, is something I hear all the time about women specifically is, why would a woman do that if she's a mother? Why would she use while she's pregnant? Why would a woman do this? Why would a woman do that? And I often would ask, like, men aren't asked the same question, right? They're not asked, they're not given that same judgment as a woman does. And so I started thinking a lot about my journey and how I got to where I am. And, I had a baby, as you all know, at 18 years old. And there was a lot of trauma that I experienced in childhood and adolescence. And so I kept making these decisions where outwardly people would judge me and think, oh, God, like, she has a son. Why would she do this? Why would she do that? Every decision that I was making was rooted in the trauma that I had never gotten help for, that a lot of people didn't even know that I had experienced. And so when we're working with this new program, all of the women that are coming in with substance use disorders, 70% of them have been abused in some way, shape, or form, but the majority of it's sexual abuse. And so when I think about my journey, and I shared this with Heather recently, back in 2011, I was living in New York City. I was in a very bad situation. I was in a domestic violence situation. I was taking Percocets every day. I found out I was pregnant. I continued to take Percocets. I continued to smoke every day. And I remember already having a son and, like, feeling like this horrible person, that why can't I just stop doing this? And it was because I was in such immense emotional pain that I was doing anything I could to numb that pain. And I remember getting to a point where I looked in the mirror. It was like, I swear it was like a movie where it was the middle of winter in Brooklyn, and I, like, didn't know how to get out of this place, right? This guy hid my car keys, and I didn't know what to do. But I remember looking in the mirror and saying, like, God, if you just get me out of this situation, I promise I will change. I will figure out what's wrong with me, because that was my mentality. Like, all these things are wrong with me. And I got out of that situation, and I'll spare everyone the details, but I just remember it was December 30th, 2011. I crossed the Brooklyn Bridge. It was like 12:05 a.m. And I said to myself, I'm just going to drive to Florida with the $60 I have in my bank account. I don't know how I'm going to get back there, but I'm going to figure it out. And I kept driving. I made it to Virginia. And when I got there, I was running out of gas. And so I was like, I'm going to pull over and sleep in my car. And I'm going to wake up at 9 a.m. and I'm going to figure it out. So I called a friend, told her what happened. And she said, Alli, I just wanted to let you know that I got a settlement check for you from a lawsuit. Not tons of money, right? But enough to get me back home. And she said, I'm going to send you the money to your bank account as soon as the bank opens. And I just remember, like, sitting on the side of this, like, highway in Virginia, thinking to myself, like, this is my chance to really make a difference in my life. And somehow, some way, one day I'll be able to pay this forward. And I kept driving. I made it back to Florida. I immediately started getting help for my mental health, and I started doing a lot of work over the next 10 to 15 years. And it's really what propelled me to go into this field of human services and mental health. And it was really because there's so many women that have these judgments cast on them for the outward expressions, but it's really, really deep emotional pain that they don't know what to do with. And so I get this honor now to work in this program with Heather, who is, a researcher and a doctor, and she has all of this research. And for me, it's relational. Everything is about a relationship, and just hearing people out and hearing their story and helping them heal through that. And I'm honored every day to do this work.
You said something to me about 2 weeks ago that really has stuck with me. That instead of saying to somebody, "What's wrong with you?" we should say, "What happened to you? What happened to you?" And that shifts the perspective dramatically.
Right.
Yeah.
And now you are here with your master's degree, and I believe you're starting your doctorate in January.
I am.
That-
Yeah. I'm starting my doctorate in January in doctorate of behavioral health. I think there's a big need for a marrying between primary care and mental health, because even though a lot of work has been done to identify trauma and how that plays into our everyday health, there's a lot more work that needs to be done. And so I'm thankful for the pioneers who are leading the way that I can kind of jump on that. But I'm really excited to be able to integrate that into just the work that we do, and then also with all the community partners that we work with. I think it's so needed, and we have such great resources here, and we have such incredible people that we work with. And I think just being able to put everybody in this big, pot of change makers, it's going to be, I'm just every day looking forward to it more and more.
I love it. So it's interesting for me right now at this moment, sitting here with the three very powerful, very incredibly talented, intelligent women who have never said the words, "Oh, I just don't think that problem can be solved. We'll forget about it." Right? That's never come out of. But I appreciate deeply that the story, because I think about what does a person who is as down and out as you can be, what do they look like? Well, they look like us. Mm-hmm. They look like, when they're given a chance, they look like us. And you two are leading this incredible effort to say, here's a chance, and here's a chance in a beautiful place. And it's not just a chance for you, but it's a chance for you and everyone that's gonna be part of your life, including your kids. I really want to hear more about. Tell us about Casa Flores. What is this place?
Take us inside, ladies.
So I didn't realize that Alli also is an amazing interior designer.
I'm sure Alli is amazing at everything she does.
So
great.
The environment is so important. I mean,
Yes.
environment is a sense of safety, and that really is the core principle of trauma-informed
And a
culture.
sense of worth. People
Yes.
look around them and say, what am
I'm
I
worth something.
That's right.
Right?
That's right.
It's these little touches, and it's just such a place of serenity. So anybody that visits it would probably want to stay, right, for a night, for respite.
beautiful.
So that the environment is, every single detail has been so well thought out and research informed, which is wonderful. I mean, I would say a year, maybe more, of really planning and designing and developing, and also making sure that all the community partners that are necessary for the mother's success and her family are in place too.
Can you talk about that? What kind of, Casa Flores is a place where a mom who has addiction can come and get treatment, and if she's pregnant can have that baby there. It's an amazing story, but what are those partners that we need? It sounds like you're saying it's not even as wonderful as this is. There's more determinants of health and success.
Compassionate and coordinated care are so essential, and know best practices for this population, and coordination, and that is really missing across the country. So, Alli, your network
I think I was on a meeting the other day, and again, there are a lot of services that exist, but it's my personal opinion that a lot of these services are just Band-Aids, and they don't fix the actual problem, right? And so with our program, I think in just the the beginning of all the conversations that we had was, we don't want to just put a Band-Aid on a problem and a temporary fix. Like, we need to get to the root cause of that. And the only way to do that is to build a comprehensive program that is more than 45 days in treatment. It's more than 60 days. It's a long-term program. And so the way that this was built was that there would be phases. And so women would come into treatment when they are pregnant. And initially, you can do work while you're pregnant, right? But your body's already going through so many physiological changes that instead of us jumping right into the deep end that you would traditionally do in treatment, let's give this woman some time just to get stable, just to feel comfortable.
And even in that phase 1, you were talking so much about relational. I mean, my research has demonstrated that the real healing is relational attachment theory. And that most of these women don't have a one person.
Yeah.
That's right. So that in that phase 1, you're forming a trusting relationship, a relationship that's reciprocal, that they're receiving kindness and acceptance and being treated as a human without having to give anything in return.
That's right.
That's
right.
In thinking about residential treatment, that's a very, very different concept. Residential treatment is you're going early in the morning till late at night, and you're going again and again and again. And I remember when we designed an older adult program, and we found that we had to be more flexible and needed time. So what you're saying is that the first part of Casa Flores isn't even focused on let's get you all this education. It's all about let's help you get stable.
Yeah.
And find some rest and safety and relationships.
And even the relationship with the pregnancy, right? I'm thinking about that. It's such a new chapter in someone's life, and they may not have had great modeling. As we know, this is so intergenerational, the cycle of substance use and trauma. So maybe they didn't have any healthy attachment with their parent. So there's that is very essential work in that phase 1.
And so when we talk about, just the day-to-day, it's really, as Heather mentioned, initially the relationship building, just getting them stable and getting them used to being in this calm environment. A lot of times when people are coming from really high trauma and chaos, calm does not feel good. Calm does not feel comfortable. Quiet is not comfortable. And so, a lot of times you'll see people that are coming from chaos, they come into this calm place and it's even more terrifying because they're not used to that.
Right.
And so getting them used to, this is a safe place. And I can't tell you it's a safe place. I can only wait till you feel that it's safe. And then from there, really, once they feel safe and they feel stabilized in this new environment, that's when we can start doing the work of how did we get here? How did we get to this point? What has happened to you that has led you down this path? Because there's a lot of shame and guilt associated with their choices. And so there's 3 phases to the program. So phase 1 is really just that stabilization period, relationship building while they're pregnant. Very early on, after they give birth, they'll come back and they'll stay on our campus. And then phase 2 is where we kind of start digging a little deeper and we start doing more of that trauma-focused group work, working one-on-one with their therapist. That's part of their program. Every day they get 1 hour of individual therapy time because, again, it's that relationship building with someone. A positive, caring adult is what kids need, but a lot of times people get trapped where their trauma is. And so if we have a woman that's coming in with trauma, we also have to remember that this is really a child inside this adult body crying out for help. And so with phase 2, we start deep diving into the trauma. And then phase 3 is all the other things that someone needs to be successful. You need to have your basic needs met. So food, shelter, clothing, housing, employability skills, and also knowing how to be a parent, right? So those are all things that are encompassed into this program is ensuring that when they leave, they have what they need to be successful. And once they leave, they're not done yet. They can still come back to our campus and continue to receive job training and therapy and an early learning center that we're building where they can actually bring their children somewhere where they don't have to worry about finding a good child care center or having a safe place to drop off their children. We really want to meet all the needs. And as Heather mentioned, one of our first conversations was, how do we eliminate barriers to quality care?
I love
So
that.
powerful.
And just thinking about the relationships, obviously there's got to be doctors and nurses and people who are, and that word coordination. And when you say, coordination can kind of be a very stale kind of, but it's relational when you're talking about it. You're talking about really developing relationships with all of the community that these people, that folks are going to need to be successful. That's beautiful.
And I think another huge factor in interrupting and preventing continual cycle, right, of intergenerational trauma and substance use is family strengthening and family reunification. I mean, I think that's one of the number reasons coming, other than Rachel and Allie, coming to Hanley. Just because 70 to 80%, as Allie shared, of our children being removed are infants. And, in some of my studies from different women from different populations shared the same thing. It's like your child being kidnapped and you're actually watching it,
right,
and there's nothing you can do.
Right.
That resonated with me as a parent, that how terrifying and how no control. So one of our goals is really to promote family reunification.
Yes.
And so we're also doing a lot of outreach and training with DCF, with all the birthing hospitals, the NICUs. And, I just heard recently, unfortunately, I won't name what hospital, but that there was no pain medication given to the woman in childbirth because she had active substance use. And, this is happening in Palm Beach County, and we need, this is a human rights violation for me, that we have the power to empower, and that we need to really address this major public health epidemic and so many children being removed that impacts the infant mental health.
It does. It does. I love, Allie, that when you designed these rooms, both in the pilot program as well as when we raised the dollars to really bring the building up out of the ground, the rooms are big enough that we can put a small bed in there for an older child and help facilitate that reunification of the family. So the mom, the infant, older children, it's so powerful.
And there's research that shows there's so much talk about family separation and foster care being inundated, and so a lot of times we think of what services can we provide to the children, but we're not providing services to the parent. So then the child stays in this cycle.
That's right.
They turn 18. They repeat the cycle
That's
because they didn't get the proper help and support.
Right.
Yes.
And then the parent just stays in this cycle, right? And when we think about family separation, there's research that shows that not only does trauma start when a baby's in utero with just, the physiological stress that a mom goes through, but the first 2 weeks of an infant's life are crucial for determining their long-term well-being. And so that family separation, people think, well, a baby isn't going to remember this. Well, maybe not right now. They're not going to remember a conversation, but it gets stored in their bodies.
That's right.
That trauma of being separated from the person that they've known for the last 9 months growing inside of her.
And a lot of the stigma of how could this person do this as a mom, and, how could they hurt their baby? And look at all the behavioral issues now with this preschooler. Not being aware of this research, that how, what a negative impact it had, the separation on an infant. And
Physically
and
and
that separation.
psychologically.
Yeah, we now know from neurobiology that not only is it helping maternal mental health, but the infant mental health, and they're being able to have healthy personality later on, and being able to trust and have interpersonal skills and all. So this is so critical, and to be thinking about, instead of polarizing the mother and the infant, saying, what can we do to keep the mother and infant as a dyad? This is a win-win situation.
Yeah. Right.
I love that.
Me too. It is, having worked in foster care and having worked in shelter care, and God bless everybody who does that work. I mean, people who are working for DCF and protective investigators and case managers, and they are doing unbelievably difficult jobs for penance, and it's the heroic what they're trying to do, and there are, and yet it is true that we have a system that sometimes can make the problems worse. And one of those places is when you separate a mom from a baby, especially when that mom is getting treatment, is getting help. So it's what you have here at Casa Flores, a place where moms can struggle and get help and have their babies and not be separated. As a researcher, right? Says it's the research says that is going to have a best outcome as a human being, and especially a human being who's been in foster care and been in shelter care, and seen the difficulties that those kids experience in care.
Right. And at risk for so many serious problems, such as human trafficking.
Yes.
The greatest risk in foster care.
Yeah.
So think about all the societal issues that we have. And I have a lot of solutions from research to address this, and I'm hoping that Hanley, that we can spread this and do trainings. I mean, think about co-parenting with foster families, right? That foster families can help parents that are struggling and work towards family reunification. Thinking about caseworkers saying, we're a team,
That's right.
and let's
Right.
be collaborative,
Right.
and we want the same thing.
Right.
So how can I help you? So you go from what happened to you, okay, how can I help you, right?
Yeah.
I love that. We don't ever have to throw the baby out with the bathwater. We just have to do it better.
Yeah.
There's a lot of people with great intention and good, and anybody who intends to help is on my side and I'm on their side. And let's figure out the best way to do it. I love that.
Yeah.
One of the statements that I've heard so frequently is, no one's ever willing to help me. That's what I've heard in countless conversations that I've had with women in the last several weeks alone, is everyone's given up on me. No one's willing to help me. And so my response is, we will help you, right? Like, we will get through this together. And just like that little semblance of support is enough sometimes to make people keep going.
Yeah.
And I think that, when we think about even separation and how it affects the infant, it also drastically increases the mother's risk for recurrence of use,
Right.
drastically increases the mother's risk for suicide,
Yeah.
postpartum depression. I mean, it's just creating a ripple effect that is not good for anyone involved. And it places more burdens on our systems of care. So why do that if we have a solution? Why create more issues if we can solve the issues at the root when it starts?
Perfectly said. I know we're coming to the end of our time. I didn't know if you had that, but
I'm just blown away by you two.
yeah.
We're so thankful that you're leading this passion project.
Yeah. I just have a funny little a funny story. When we were in North Carolina, we had been traveling. We went to New Jersey first to tour a location there. Then we got right back on a plane and flew to North Carolina, and we were all hungry and just exhausted. And I think Heather went in the store, and Rachel said, "Allie, we need to hire her." And I was like, I mean, it was like 9:30 and we're delirious. We're traveling literally all day, like 3 plane rides. And she's like, we need to bring her on. And then Heather got back in the car from being inside the store. And Rachel's like, so do you want to work for us? And Heather's like, I'm sorry, what? It was just like this very...
Hello, nice to meet you. Come work for
Yeah,
us.
I just met you this morning. Do you want to come work here?
It was a long day.
It was.
There's
Well,
plenty
The
of time.
delirium worked in our favor.
I, for one, am glad you did.
Yeah.
I'm so excited to be
Yeah.
a part of this team, and really, we're going to make a difference.
We are.
So
We're
we
gonna
like
help
to give
so
you
many
the
women.
we like to give you all both the last word. And so thinking about what would you want people to hear from you, if you could just say one thing to our audience today. I'll start with you, Alli. What would it be?
Oh, I have lots of things to say all the time, but I would say that instead of judging people and looking down on them, reach out a hand and ask them how you can help, because we all have a duty to other humans, and it's to help them. And don't judge, find out the why behind the behaviors, because there's always a why. And every single person, despite what they do, there's always good. No matter how much negative you see, every person is inherently good.
I love that.
That's my
Thanks,
that's
Alli.
my tidbit of advice.
That's great. I think for anyone listening, asking yourself, do I feel judgment towards this population? They are the most stigmatized demographic of all.
Yeah.
And, Alli touched on it really briefly, of that we always put this towards moms and not fathers. And we know from the literature, it's both parents,
Right.
that are usually using, right? A lot of times the mother's introduced substances by the partner.
Yes.
So we do have in our society this idolization of motherhood, and there's a lot of pressure on women to be the good mother. So I always, just reflect on that and say that we need to support, right? I always say support, not stigma. Support, not stigma, because they feel the most stigma themselves and the most shame. And shame is a construct that is so difficult to tolerate.
Yeah.
Out of all human emotions, right? Shame.
Yes.
So if what we can all do, no matter who you are, you can say, I'm going to be supportive instead of stigmatic.
I love it.
And everybody can do it.
Thank you. Alli, Heather, Dr.
Amazing.
D.
Thank you.
Dr. D.
Thank you. Thank you guys so much. And thank you, everybody, for listening. We'll see you next time on The Hanley Effect.
All right. Bye, ladies.
Thank you for joining us for the Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.